cochlear implants, there's certain criteria you would even consider. Who would that be?
Sure, cochlear implants are there's some very specific criteria for them, and the indications are bilateral, both sides, hearing loss, profound hearing loss.
What would be the decibel loss that you would say would be the threshold for considering it?
It actually, by the Medicare and some of the other insurance standards, they actually do a hearing in noise test, otherwise known as a HINT test. And that's a specific audio test, an audiogram that's performed by a cochlear implant audiologist that determines your eligibility for a cochlear implant. But the decibel level is usually profound, 80, 90, 100 decibels. You almost have to be completely deaf.
Okay, and if they even consider doing it, will they do both sides or one side initially?
Initially when we started doing cochlear implants, it was only unilateral implantation. But nowadays, we're seeing more benefit in doing bilateral cochlear implants.
And if they do it, is the hearing going to come back normal or different?
It's a good question. Patients who have had speech prior to losing their hearing, the prelingually deaf, do much better than those that are postlingually deaf. So with cochlear implantation, patients who have had speech prior to losing their hearing do much better than those who have never had speech. And when you ask the question, can you hear normally, the best way that I can describe how patients hear is that after cochlear implantation, a patient can pick up the telephone usually and is able to talk without lip reading. Which gives you a sense of the level of sound input and understanding with cochlear implant.
And they're getting better and they're getting smaller. Is that true?
They are. They're getting better. They're getting smaller, and we're able to implant both sides in some patients. Now, a specific type of ENT surgeon does this procedure. Someone called a neurotologist, and they're ENT surgeons who specifically do ear surgery alone.